Bismillahirrahmanirrahim. Today our topic of discussion is the types of rickets. And first of all, we should know what are the different types, and then we will discuss the labs, and finally how to investigate them. And in the next session, we will discuss the treatments of the rickets. Number one, we have vitamin D deficiency rickets, and it can result from lack of sun exposure, dietary inadequacy, prolonged breastfeeding without vitamin D supplementation, fat malabsorption, anticonvulsant therapy, and renal 1 alpha hydroxylase deficiency, resulting in deficient production of 125 hydroxy vitamin D dependent type 1. Secondly, there is end organ resistance to 125 hydroxylase deficiency, and it is known as vitamin D dependent type 2. And third, there is hypophosphatemic rickets, and they are due to phosphate deficiency from renal phosphorus loss, occurs in X-linked hypophosphatemia, and mostly the diseases are Fanconi syndrome, Lowy syndrome. Inadequate phosphorus intake can occur in premature infants and with use of total parenteral nutrition. And this is also known as vitamin D resistant ricket. Fourth, we have calcium deficiency in children on a vegetarian diet low in calcium and with a high intake of phytate and fiber with decreased calcium absorption. And lastly, we have renal tubular acidosis, so also known as rickets. How they clinically present and how we can differ these for 5 types of rickets clinically. Infant with fluoride vitamin D deficient rickets may present with tetany or convulsions due to hypocalcemia, poor feeding, muscle weakness, hypotonia, irritability, failure to thrive, and delayed motor development are common clinical features. Along with this, frontal bossing, craniotabes, widening of wrists, bowed legs, and a rachitic rosary and large costochondral junctions may be evident. Patients with hypophosphatemic syndromes usually have a family history of rickets, and alopecia and oligodontia are associated with vitamin D resistant rickets. Now, finally, we have come to the labs. How to diagnose them? Serum calcium, phosphorus, magnesium, albumin, creatinine, alkaline phosphatase, and blood pH, and carbon dioxide. Total acid-base ABGs. Plasma 25 hydroxy D and 125 hydroxy D levels, plasma parathyroid hormone levels, Raystein films, urinary calcium, phosphorus, magnesium, pH, creatinine, and amino acids. Thank you so much.